Hi everyone, welcome to our fourth day in our 7 days glaucoma awareness week. So in this video, I'll be talking about what glaucoma is all about. Glaucoma is one of the diseases that cause irreversible blindness in our world today. In glaucoma, there's something we call the optic nerves. The optic nerves are being damaged in glaucoma. Now, the optic nerves are small cables that carry information from the eyes to the brain. Are the cables that connect the eye to the brain. So at the center of this cable, that's what we call the cup. When glaucoma is being damaged, when the optic nerves are being damaged, that cup increases in size. And when the cup to this ratio is more than 50%, that's when we start suspecting glaucoma. Though that is not only what is being used to judge if a patient has glaucoma or not. So there are things that we use in judging if a patient has glaucoma or not. Now take this acronym as nerve. The N stands for nerve. Now the nerve you're checking for the overall appearance of the nerves. Is there any damage? Is there any abnormality? What's the size of the cup to this ratio? You're just checking everything, overall appearance of the nerves. The nerves is what we call, that the E stands for the extent of the rim loss. Now the extent of the rim loss talking about the rim is the rim turning off. Now the rim is the distance between the cup to the disc. That's the distance between the edge of the cup to the margin of the disc. So in the brain, there's something we call Isn't rule. I stands for the inferior, S stands for superior, N stands for nasal, and T stands for temporal. Now this isn't true. It's trying to tell us that the inferior should be thicker than the superior. The superior should be thicker than the nasal. The nasal should be thicker than the temporal. If this isn't true, is being violated, that's when you can suspect glaucoma. The R stands for the retinal nerve fiber layers. How are the retinal nerve fiber layers? Is there any defect? Is there any abnormality? The V stands for vascular, that's the vessels. Now you're looking at the vessels. Are there hemorrhages? Are there burning vessels or bent vessels? Are there barring of the circumlunar vessels? Are the circumlunar vessels bad? Are there nasalization of the vessels? When you see all these signs, you can suspect the patient for glaucoma. Then another thing is the last E there is what we call the edge. Now the edge is trying to tell us, is there any peripapillary atrophy around the disc margin? Now in this one, you're looking out for the beta zone peripapillary atrophy because it's more common in glaucoma. There are tests that we use in diagnosing glaucoma. Number one is the tonometry test. Now the tonometry test measures the intraocular pressure of the eye. That's the eye pressure. The eye pressure ranges from 10 mm mercury to 21 mm mercury. That is the normal range. But when the pressure of your eye is greater than this 21 mm mercury, that's when you can suspect glaucoma. But sometimes your pressure can be within normal range, but glaucoma damage has already been done. Or your pressure can be within normal range, but you have glaucoma. That's when we will now talk about normal tension glaucoma. The next is what we call the next test is what we call pachymetry. Now, pachymetry measures the central corneal thickness. In central corneal thickness, trying to tell us whether the cornea is it too thick, is it too thin. The next test is what we call central visual field. In central visual field, this test is trying to measure what can you see in your field of view. when you're looking straight ahead, what can you see in your field of view? Because in glaucoma damage starts from the sides. That's the peripheral part of the peripheral part of your vision. Glaucoma start eating up the peripheral part of your vision until it's advanced stage where it affects the central vision. Now, what the CVF or the central visual field test is doing is to find out is there any defect around your field of view? Is there any defect? Is there any scotoma around your field of view? The next is what we call gonioscopy. Now, gonioscopy measures the anterior chamber angle of the eyes. Is it shallow? Is it deep? Is it moderate? The next test is what we call OCT, that is ocular coherence tomography. Now, this test analyzes the retinal nerve fiber layers, because when glaucoma starts, it eats off the superior and inferior retinal nerve fiber layers. In glaucoma, especially the primary open angle glaucoma, it doesn't come with symptoms. You don't feel pain, you don't feel redness, you don't feel anything until it's advanced stage. That's why glaucoma is being called the silent tip of sight. So glaucoma does not give a symptom. So that's why regular eye checkup is very necessary. It's highly necessary. In our next video, we'll be talking about types of glaucoma. What are the types of glaucoma? Does children also have glaucoma? Glaucoma, is it just for adults? Does it come with age? So in our next video, we'll be talking about types of glaucoma and we'll be breaking them down gradually. See you in my next video.